Welcome to today's lecture on the intricate mechanisms of blood pressure regulation and fluid homeostasis in the human body. In this lecture, we will delve into various topics that contribute to the understanding of these essential physiological processes. We will explore the intrarenal mechanisms of blood pressure regulation, the role of the sympathetic nervous system, the impact of vasopressin and aquaporins, renal autoregulation, endothelial dysfunction, oxidative stress, vasodilatory peptides, renal denervation, the sodium-potassium ATPase, and hormonal and non-hormonal mechanisms in pregnancy. By the end of this lecture, you will have a comprehensive understanding of these topics, enabling you to apply this knowledge in clinical practice. So, let's begin our exploration of these fascinating subjects. In order to maintain blood pressure within a healthy range, the kidneys employ a variety of mechanisms. These mechanisms involve the regulation of glomerular filtration rate, GFR, the renin-angiotensin-aldosterone system, RAAS, and tubular reabsorption. The constriction and dilation of arterioles, controlled by substances like prostaglandins and nitric oxide, regulate the GFR. The RAS, in response to reduced renal perfusion pressure, releases renin, which converts angiotensinogen to angiotensin I. Angiotensin II, a vasoconstrictor, stimulates aldosterone release, leading to increased sodium reabsorption and water retention. These intrarenal mechanisms work together to regulate blood pressure and maintain balance. Fluid homeostasis is crucial for the well-being of critical care patients, especially those with compromised physiological conditions. Achieving fluid balance in these patients requires a thorough understanding of their underlying pathophysiological state. Various factors contribute to fluid homeostasis, such as water intake, renal excretion, extracellular fluid volumes, and electrolyte concentrations. In critical care patients, fluid management becomes crucial to maintain stable hemodynamics, prevent organ dysfunction, and optimize patient outcomes. Strategies for fluid management may include the use of crystalloids and colloids, based on the patient's condition and the goals of therapy. Adequate monitoring, through methods such as central venous pressure monitoring, may assist in determining the appropriate fluid therapy. However, it is essential to consider individual patient characteristics, comorbidities, and possible complications while formulating a patient-specific fluid management plan. The sympathetic nervous system, SNS, plays a significant role in blood pressure regulation. Sympathetic outflow to the kidneys increases renin release, leading to the elevation of angiotensin II levels and subsequent vasoconstriction. Moreover, sympathetic stimulation contributes to increased heart rate and contractility, which further elevate blood pressure. In conditions where sympathetic overactivity persists, such as in primary hypertension, dysregulation of the sympathetic nervous system leads to sustained vasoconstriction and increased systemic vascular resistance. Targeting the sympathetic nervous system through pharmacological interventions or the utilization of neuromodulatory techniques can be effective in managing hypertension and improving patient outcomes. Vasopressin, also known as antidiuretic hormone, ADH, plays a critical role in fluid homeostasis. Released from the posterior pituitary gland, vasopressin acts on the renal collecting ducts to regulate water reabsorption. Vasopressin exerts its effects by binding to vasopressin 2 receptors, V2 receptors, on the basolateral membrane of the principal cells in the collecting ducts. This binding activates adenylate cyclase, increasing intracellular cyclic adenosine monophosphate, CAMP, levels. Elevated CAMP levels trigger the insertion of aquaporin 2 channels into the apical membrane, facilitating water reabsorption by allowing water molecules to passively move along osmotic gradients. The dysregulation of vasopressin release or disturbances in aquaporin expression and function can lead to disorders such as diabetes insipidus or hyponatremia, respectively. Renal autoregulation is crucial for maintaining stable blood pressure by adjusting renal blood flow and glomerular filtration rate despite changes in systemic blood pressure. The myogenic mechanism involves the constriction and dilation of smooth muscle cells within the kidneys to maintain a stable filtration rate. Tubuloglomerular feedback detects changes in sodium chloride concentration and triggers adjustments in arteriolar resistance to maintain proper filtration. Disruptions in renal autoregulation can lead to abnormal blood pressure control, seen in conditions like preeclampsia and chronic kidney disease. The myogenic and tubuloglomerular feedback mechanisms work together to regulate renal blood flow and glomerular filtration rate. Vascular smooth muscle cells in the afferent arterioles sense changes in arterial pressure and respond with vasoconstriction or vasodilation. When blood pressure rises, the afferent arterioles constrict, reducing blood flow into the glomerulus. This constriction helps to maintain a consistent GFR. Conversely, when blood pressure decreases, the afferent arterioles dilate, allowing for increased blood flow into the glomerulus. The tubuloglomerular feedback mechanism involves the macula densa cells in the distal tubules sensing changes in sodium chloride concentration. If sodium chloride delivery to the distal tubules decreases, the macula densa cells signal vasoconstriction of the afferent arterioles, reducing GFR to conserve water and solutes. This coordination between the myogenic and tubuloglomerular feedback mechanisms helps to maintain renal function and blood pressure regulation. Endothelial dysfunction plays a significant role in the development and progression of hypertension. The endothelium, a single layer of cells lining the inner surface of blood vessels, plays a crucial role in regulating vascular tone and integrity. Dysfunction of the endothelium disrupts normal vasodilation and vasoconstriction processes, leading to the development of hypertension. Several factors can contribute to endothelial dysfunction, including oxidative stress, inflammation, and impaired nitric oxide bioavailability. Endothelial dysfunction can result in increased vascular tone, augmented platelet aggregation, elevated endothelin-1 levels, and reduced nitric oxide production. These alterations collectively contribute to the pathogenesis of hypertension and its associated complications. Understanding the mechanisms underlying endothelial dysfunction is essential to develop targeted therapeutic approaches to manage hypertension effectively. Oxidative stress, caused by an imbalance between reactive oxygen species, ROS, and antioxidants, influences hypertension and impaired fluid balance. ROS like superoxide, hydrogen peroxide, and hydroxyl radicals have both physiological and pathophysiological effects on blood pressure regulation. Elevated ROS triggers endothelial dysfunction, increased vasoconstriction, and inflammation, leading to hypertension. Additionally, oxidative stress disrupts ion channels, transporters, and signaling molecules in the renal tubules, further impacting fluid balance regulation. Lifestyle changes, antioxidant supplements, and medications targeting oxidative stress could potentially alleviate hypertension and restore fluid homeostasis. Vasodilatory peptides play a crucial role in blood pressure regulation by promoting vasodilation and counteracting vasoconstrictor mechanisms. Several vasodilatory peptides, including atrial natriuretic peptide, ANP, brain natriuretic peptide, BNP, and adrenomedulin, exert their effects by acting on specific receptors within the vasculature and renal tubules. ANP and BNP, secreted by cardiac myocytes in response to increased cardiac wall tension, enhance natriuresis and diuresis, resulting in decreased blood volume and systemic vascular resistance. Adrenomedulin, secreted by various tissues, exhibits potent vasodilatory effects and also enhances natriuresis. The therapeutic potential of these vasodilatory peptides has been explored in the management of hypertensive patients. Pharmacological analogues of these peptides, such as neprilysin inhibitors, have shown promising results in reducing blood pressure and improving cardiovascular outcomes in patients with heart failure and hypertension. Further research is ongoing to unravel the full therapeutic potential of vasodilatory peptides in hypertensive management. Resistant hypertension, defined as persistent high blood pressure despite optimal medical therapy, poses a significant challenge in the management of hypertensive patients. Renal denervation has emerged as a potential therapeutic option for patients with resistant hypertension. Renal denervation involves the targeted ablation of renal nerves using either radiofrequency energy or ultrasound waves. This procedure disrupts the sympathetic input to the kidneys, thereby reducing systemic sympathetic activity and potentially lowering blood pressure. The efficacy and safety of renal denervation for resistant hypertension have been evaluated in several clinical trials, showing varying degrees of success. While some trials have demonstrated substantial blood pressure reductions, others have yielded inconclusive results. Further research and refinement of patient selection criteria are necessary to fully establish the role of renal denervation in the management of resistant hypertension. The sodium-potassium adenosine triphosphatase, Na+/K+ATPase, is an essential membrane protein found in most cells, playing a vital role in maintaining cellular fluid balance and regulating sodium and potassium ion concentrations across the cell membrane. In the renal tubules, the Na+/K+ATPase is responsible for actively reabsorbing sodium ions from the tubular lumen into the epithelial cells, while simultaneously moving potassium ions out of the cells and into the tubular lumen. This process establishes the concentration gradient necessary for secondary active transport of other solutes and water reabsorption. Any dysfunction or impairment of the Na+/K+ATPase can disturb fluid balance, leading to altered renal sodium handling, electrolyte imbalances, and impaired blood pressure regulation. Understanding the role of the Na+/K+ATPase in fluid balance regulation is crucial to comprehending the pathophysiology of fluid disorders and developing targeted therapeutic strategies. Pregnancy presents unique challenges to blood pressure and fluid balance regulation due to dynamic hormonal and non-hormonal changes. Hormonal mechanisms include the activation of the renin-angiotensin-aldosterone system, RAAS, increased levels of vasopressin and oxytocin, and alterations in atrial natriuretic peptide, ANP, and brain natriuretic peptide, BNP, secretion. These hormonal changes aim to maintain blood pressure and fluid balance essential for the growth and development of the fetus. Counteracting these hormonal mechanisms, non-hormonal factors such as maternal plasma volume expansion, decreased systemic vascular resistance, and enhanced glomerular filtration rate, GFR, also influence blood pressure and fluid balance during pregnancy. Dysregulation of these mechanisms can lead to pregnancy-induced hypertension, PIH, and other complications. Understanding the intricate interplay between hormonal and non-hormonal mechanisms is crucial in diagnosing and managing pregnancy-related hypertension and optimizing maternal and fetal outcomes. In conclusion, the regulation of blood pressure and fluid balance involves intricate mechanisms within the human body. Understanding these processes helps healthcare professionals manage hypertension and impaired fluid balance. Factors such as intrarenal mechanisms, the sympathetic nervous system, vasopressin and aquaporins, renal autoregulation, endothelial dysfunction, oxidative stress, vasodilatory peptides, renal denervation, sodium-potassium ATPase, and hormonal and non-hormonal mechanisms in pregnancy play important roles. Further research is needed to improve patient outcomes and develop more targeted therapeutic interventions.